One of the fortunate things about the disciplines that we work in is that technology continues to grow and to advance and to improve. We continue to see improvements in imaging technologies, in radiation therapy delivery, in radiopharmaceutical development. I think that as we go forward, we're probably going to see one of those sharp jumps in the impact of those technologies on clinical practice. I think in the first instance, the idea of the image as a biomarker is going to become important. Whether it is a diagnostic biomarker or a therapeutic biomarker or even a theranostic, I think the image is going to become a lot more important in helping manage care. I obviously speak from my own area of interest, which is cancer, but I think we've seen it already in cardiology, and with some of the Alzheimer's imaging compounds, we're going to probably see it in neurology and dementia care as well. So I think the first thing we're going to see is the image intersposing after just the diagnosis of the disease, but helping in treatment planning, helping in predicting outcome, perhaps most importantly in stratifying patients for treatment. We now know that the biology of a cancer, for example, is as important, if not more important, than where the cancer started. And so many of the novel biological therapies targeting a specific signaling pathway may be found in a percentage of patients with lung cancer and gastrointestinal cancer. We're targeting a pathway. We know that we can begin to image some of those pathways. Hypoxia is one that we can look at. So I think we will see that the use of image becomes more sophisticated. Secondly, the image in radiation therapy planning is clearly now the most important tool that we have. And one of the things I'm very proud of is how we've been able to integrate a great deal of teaching in cross-sectional anatomy and three-dimensional imaging into the new course that we developed at the University of Alberta. I think that is truly going to prepare therapists for practice in the second and third halves of the 21st century. That ties in with an understanding of the biology of the disease that we are looking at, imaging, treating, helping to provide information to the referring physician on. So I think that's going to be a really important area. But I do think that we have to look at how we can incorporate artificial imaging into what we do, how we can incorporate radiomics into what we do. So using population health techniques to improve what we do in the imaging clinic, in the radiotherapy clinic, I think is a huge opportunity for us. And as that applies to medical radiation technologists, I see huge opportunities arising. My view is that the most important thing that we can now offer the profession from the University of Alberta is a master's degree leading to advanced practice, ultimately a PhD leading to a consultant technologist status. I think the technologist community is a huge untapped resource for medicine. And I think those are many of the people who will be bringing skills in coding, skills in artificial intelligence, skills in using image display formats to significantly enhance what we can offer our patients. And I think a lot of that clinical research can come from the technologist community. It's happening in the UK, it's happening in Europe, it's happening in Australia. I see no reason why it can't happen in Canada. And I think importantly, again, it goes back to this idea of giving people the skills to grow in the job that they have, the autonomy to use those skills for maximum benefit to the patient and to the system. I look forward in 10 years' time to seeing what that advanced practice idea looks for. I hope it's grasped by both the administration and by the technologies community, because the benefits could be huge.